Hello, my name is Hector Santiago, and we're going to be discussing ankle fractures. This is week 3 of our oral presentations for our home month. So ankle fractures are very sort of a big deal, as they are very commonly questions that were asked in externships, and they're a very common topic discussed with residents and attendings at externships. So to understand ankle fractures, one might not just look at the bones and the joints that are hindered with an ankle fracture, but one must also look at the ankle ligaments. So ankle ligaments, such as our ankle ligaments on our lateral side, will have ATFL, CFL, and PTFL. And then on our medial side, which is our stronger set of ligaments, we'll have the deltoid ligaments, which is further subdivided into superficial and deep ligaments. Our superficial ligaments consist of superficial talotibial, our naviculotibial ligament, and our tibial-calcaneal ligament. And then our deep ligaments on our medial side are the anterior talotibial and our deep posterior ligaments. Also, to look further into the injury, one must look at and take into consideration the syndesmotic ligaments of the ankle, such as the AITFL, PITFL, and interosseous ligaments. And one must also take into consideration our Bassett's ligaments, which represents the deepest portion of the AITFL ligament. So, one of the biggest things about ankle fractures is their classification system for it, and it's a very commonly PEM question. So Log Hansen and Dennis Weber's are the main two sought after classifications when discussing ankle fractures. So Log Hansen has many stages and different categories in it. So, for example, our first one is supination adduction, also known as SAD. So this is further divided into 2 stages, with stage 1 being rupture of the lateral collateral ligaments or transverse lateral malleolus fracture. Stage 2 is vertical medial malleolar fracture. Then we can go on to the next category of Log Hansen, which is supination external rotation, also known as SIR. So this supination external rotation is the most common mechanism of injury for ankle fractures. So you'll have your stage 1, which is rupture of the anterior inferior tibiofibular ligament, or a Taylor-Shaput fracture, or a Wagstaff fracture. Just for clarification, a tibial-Shaput fracture is an avulsion fracture of the anterior lateral tibia from the AITFL ligament. And then a Wagstaff is an avulsion fracture of the anterior medial fibula from the AITFL. So then we'll go on to stage 2, which describes a short oblique fibular fracture beginning at the level of the syndesmosis, thus resulting in a posterior spike. And this is the most common type of supination external rotation fracture. Then we'll go to stage 2, which is a Volkmann's fracture. And then Volkmann's fracture is a posterior tibiomalleolar fracture from the PITFL. Stage 4 is a transverse fracture of the medial malleolus or a rupture of the deltoid ligaments. Log Hansen continued. We have your pronation abduction, also known as PAB, which is a transverse fracture of the medial malleolus or a rupture of the deltoid ligament. Stage 2, which is rupture of the anterior inferior or posterior inferior talofibular ligaments, or a tibial-Shaput or Wagstaff fragment. Stage 3 is a transverse or comminuted fracture of the fibula at the level of the syndesmosis, thus resulting in a lateral spike. Then we have pronation external rotation, or PER. This has 4 stages. So stage 1 of this one first describes a transverse fracture of the medial malleolus or a rupture of the deltoid ligament. Stage 2 is a rupture of the anterior syndesmosis or a rupture of the interosseous membrane, or a Taylor-Shaput fragment, or a Wagstaff. Stage 3 is a spiral fragment of the fibula above the level of syndesmosis and can go up as high as the fibular neck. So fracture as high as the fibular nexus is termed Mason-New fracture, which is a proximal fibular fracture. And then we have stage 4 was a posterior talofibular ligament rupture or fracture of the posterior malleolus. Moving on, we also have Dennis-Weber classification, which I spoke about earlier. So both Log Hansen and Dennis-Weber classification sort of go hand in hand when discussing ankle fractures to physicians or residents. So Dennis-Weber is a classification that's based on the location of the fibular fracture with respect to the syndesmosis. So this is divided into 3 types of Dennis-Weber's. Type A, which is below the syndesmosis. Type B, which is at the level of the syndesmosis. And then we'll have type C, which is above the level of the syndesmosis. So continuing to discuss about ankle fractures, there's also radiographic findings that we can look at after fixation, such as our Dime sign, which has been termed a useful radiographic sign for fibular length. You can also, there's a bunch of treatment options and modalities, but most commonly we go with the ORIF, which is an internal fixation, open reduction internal fixation method. So we actually, we either plate it or put screws in there to help. So that is all that I have discussed for this week for ankle fractures. If you have any questions, feel free to reach out. But thank you so much for your time.